I'm Justin Tortolani, Medical Director of the Spine Institute at University of Maryland St. Joseph Medical Center. Cervical total disc replacement, or simply cervical disc replacement for short, is a way to replace a damaged disc in the neck with a new disc, an artificial disc that moves. So one of the most common conditions that we treat is disc herniation or disc bulge that presses on the nerves in the neck and cause severe pain in the neck that can radiate into the arms and sometimes even cause weakness in the arms or hands. That's the most common cause for disc replacement. And disc replacement has been used more recently to supplant the need for doing something called a disc fusion, which has been around for 40 to 50 years. So we generally recommend cervical disc replacement after someone has failed typical non-surgical methods. Most of the time when someone has a disc herniation causing nerve pain, it'll get better on its own. Sometimes we'll treat with physical therapy or sometimes with oral medications, and finally, sometimes even with injections of steroids around the nerve to help quiet down the nerve pain. If those typical measures fail, why then patients can be a candidate for cervical disc replacement. Cervical total disc replacements are always performed through the front of the neck. So a small incision is made, and then we're able to just move the soft tissues, which include the breathing tube, as well as the esophagus, to the side, and that gives us very good access to the discs in the front of the neck. The disc can then be removed with special instruments, and then we measure and size the space of the patient's disc, and then replace it with an appropriately sized disc replacement. Cervical total disc replacement surgery generally takes about an hour for one level, one disc to be replaced. Most patients would arrive in the hospital in the morning and they'd be going home by early afternoon. One of the biggest risks of the surgery is a sore throat. Because we have to move the windpipe, we do need to monitor the airway for the first few hours after surgery. But generally speaking, patients are able to go home same day. If we have to do two-level surgery, then the surgery generally takes about an hour and a half or so, but the time in recovery and the ability to go home doesn't change. So thankfully, the recovery is quite quick. I liken this to changing the tire on your car once it's become flat. Once the disc replacement is inserted, it's immediately stable, and so you can drive on it right away. Patients often go home the same day, sometimes overnight, but often within 24 hours, they've left the hospital and they can be walking and doing normal light daily activities immediately. Rigorous sports requiring head rotation, such as swimming or golf or tennis, generally requires 3 months prior to return to those sorts of sports. So I think one of the most exciting things in the world of spine, and maybe orthopedics in general, is the use of 3D printing to replace parts of the spine or parts of the skeleton that we're removing. We're certainly not there yet, but you could imagine a time where we're actually able to reconstruct bony elements with the use of a 3D printer and then insert those back into the body to replace parts that have been removed. We're already using 3D printing as an operative template. So we have some patients who have severe deformities in their neck or their back, and we can template their spine and actually use a model that's been 3D printed in the operating room so we can learn the bony anatomy and appropriately treat that deformity without risking other neurologic structures like the spinal cord or the spinal nerves. University of Maryland St. Joseph Medical Center, I can proudly say, is the leader in patient safety in our region. Every year it gets voted highest in terms of patient safety, patient satisfaction. It's something we take great pride in. Our infection rates are the lowest in the state, and our length of stay and recovery are also incredibly favorable. The nursing care here as well is just top-notch. I can't say more about the quality of care here at St. Joe's. By far the most gratifying aspect of what I do as a spine surgeon is improving the quality of life for patients. And one of the most enjoyable things is when patients come back and simply say, "Thank you, you've changed my life." And when patients present with severe pain and they are able to get over that pain and get back to the things they like to do, it's incredibly gratifying.